I don't know if you can see that. There's a belly button there, and then there's a sort of dent between, but below the I think it's below. I think I've got it the right way around. That's the next thing. I think it's below the belly button. So obviously there's a sort of dented in scar. Again, the actual scar itself is hard to see, not least because it's in a shadow. But that is so as I say, the last one was a stretched scar. This is a dented scar. So if the scar is dented in, it's puckered in, it's often the way on the abdomen. It's often appendix. This isn't an appendix. I'm not sure what this is. Oh, here we go. I've got some. Hi, I have an abdominal scar that I have had for approximately 45 years. Wow. And would like to know if it is something that can be changed at all, please. I'm not sure if it's scar tissue underneath it, but it bulges and makes me very self-conscious and unhappy. So, wow, 45-year-old scar that. So that's obviously something as a child. And it's often the way in the abdomen that you get scars like this. Dented in scars, because there's quite a lot of fat between the skin and the anterior abdominal wall, and this sort of thing is not uncommon with an appendix. I've got a photo on my website of an appendix scar that I revised, which is similar to this, very dented in, and the scar tissue goes all the way from the skin down to the abdominal wall, and that makes it puckered in. Now you might think just cut it out and stitch it up, but if we just cut it out and stitch it up, we give you a scar just the same as what you've got, and it'll probably look all right to start off with because you've cut all the scar tissue and look all right, but more scar tissue will form, and it'll just come back again. You'll just get another dented scar. So that's not an option. What you need to do is we need to get some healthy fat over the scar. Now, one thing I would say is that weight loss might help. Now, I'm not saying this patient is overweight, but I'm just saying that the fact that there is a bulge is made more obvious by the more fat there is in the abdomen, the more sort of bulging they'll have on either side of the dent. And anytime you have a dent, it'll look more bulgy than it is. But if you were to lose some weight, that would help with those bulges. It might not. It'll probably still be a puckered scar, but it would look better. And it is something that would be amenable to surgical revision, and surgical revision would involve cutting it out, keeping the dermis, keeping the layer underneath the skin, letting that drop down, and then you'll have a defect there. Oh, it's above the belly button. Oh God, okay. There you go. Right, can we just forget the last? Actually, that's a lot better. Actually, that lighting's a lot better, isn't it? Right. Okay. So it's above the belly button. Okay. So I did have it upside down. That was obviously a top. I thought it was trousers at the bottom. Okay, that's awkward. So anyway, the surgery or the process would be the same. So it would be sort of cutting out the scar, giving you a fresh scar in the same place. So that's the important thing to stress. So anytime you do a scar revision, you're still going to have a scar. So we're just still going to give you a fresh scar in the same place, but you just sort of just take the skin off. So leave the sort of dermis, leave the bit underneath the skin, let that dermis drop down, and then you'd have to get some of the fat from either side of the scar and then bring it over the top of that dermis to give yourself a buffer, to give yourself some healthy fatty tissue, so that there's not a line from the skin down to the abdominal wall of scar. You want to break it up by bringing some fat over the top of the scar and not having a line of scar to allow that scar to go all the way back down to the abdominal wall. Because whatever happens, once you finish the surgery, you will have more scar. You will have a line of scar, no question about it. What we've got to try and do is stop that scar from scarring back down and giving you exactly the same problem as what you've got now, because that unfortunately is a risk. Anytime you do scar revision, you're creating new scars, and perish the thought you could actually have a scar worse than the original scar, because it'd be very obvious to start off with. So that's one. It won't be more obvious because of the redness. But so peris thought it'd be worse. We wouldn't do it if we thought it was going to be worse, but that's always possible. But even if it's not worse, it could be not better, and that is the risk, that you think you've done a great job, and often it looks fine to start with, but then over time it can potentially scar down again and cause a recurrence of the puckering. So it's easier than people think it's easier than it is to revise puckered scars. They're never as easy as you think it's going to be, because you are fighting scar. We are fighting the scar all the time, and we just have to try and give you a different scar which is better than your scar. So as I say, there are things we can do to give you a better scar, or a different scar, and hopefully, let's go around and right, hold that upside down. That was good, wasn't it? I see what I couldn't have. Well, I probably could have rotated it if I'd done it on the computer. So it's all, scar revision is all about giving a different scar and hoping that our scar is better than the original scar. And unfortunately, to be honest with you, we can never guarantee that. So it's always going to be, it depends on how much it bothers you. So if it doesn't bother you that much, I'm like, and maybe losing a bit of weight might help, taking some fullness on either side of the scar. I'd be like, But if it bothers you a lot, it's something that could be addressed with surgery, to as I say, get some healthy tissue over the top, in between the scar and the skin and the abdominal wall, because at the moment you've got scarring all the way from the skin to the abdominal wall. There's normally fat there, and the scarring all the way down. So we have to sort of get some healthy fat on either side to try and bolster it up to stop it from scarring down.